Well, good morning, everybody. My name is Vijay Kannan. I am head of the management department here in the Huntsman School of Business. It's my pleasure to welcome you this morning to our panel discussion, how COVID-19 is disrupting access to your favorite products, AKA, I will never take supply chains for granted again. Delighted to be joined by four industry leaders here who have lived through this year and have tremendous perspective in terms of how supply chain organizations within their organizations have had to respond very rapidly to clearly a very challenging and difficult year. You think about where we started out this year. We were wondering about whether we would ever be able to get toilet paper again or disinfecting wipes. We went from there to PPE becoming part of the everyday language. And now we're at a point whereby organizations are trying to figure out, how do I move, billions of vials, or sorry, I should say hundreds of millions of vials of vaccine in a way which keeps them cold and in a way which allows us to develop, glass vials which will actually withstand the minus 80-degree temperatures that they need to be moved in. So it's been quite a year for supply chain professionals. It's been quite the ride. Let me begin by quickly introducing our four panelists. We have Allison Corry. Allison is the Assistant Vice President of Sourcing for the Intermountain Healthcare Supply Chain Organization. Gary Peterson is Executive Vice President of Supply Chain and Production for O.C. Tanner. James Sneddon is Senior Director of Strategic Sourcing for Albertsons Companies. And Larson is Senior Demand Analyst for ThermoFisher. So we have a breadth of industries represented on our panel this morning. Each of our panelists has been right in the thick of things this year. So what we'll do this morning is the following. We'll begin by having each of our panelists introduce themselves and provide a little bit of context for their roles, their organizations, to kind of situate themselves in the context of this panel. And from there, what we'll do is we will essentially start at the beginning of the year and work our way forward from the spring to today to see how these different organizations have had to respond to the challenges of the year. So with that, Allison, maybe I'll start with you. If you can maybe just introduce yourself and talk a little about your role and your organization. You're on mute.
Thank you. If I had a nickel for every time that's been said this year, I think I'd be rich. So appreciate the quick catch there, Vijay. My name is Allison Corry, and I'm the AVP over procurement at Intermountain Healthcare. So Intermountain Healthcare, obviously a name here that folks tend to recognize, but by way of background, we have 41,000 caregivers in 24 hospitals and a couple hundred clinics in mostly Utah, Idaho, and Nevada now. And I have been with the organization for just shy of a year and a half, having moved here from the Midwest and moved out of Big Four consulting to take this role. So by way of responsibility, I have the category management and sourcing teams, purchasing, the analytics that supports those, and all of the contracting. So we manage about approaching $3 billion in spend each year that comes under my team's management. And so this year we learned lots of interesting things about how to source from overseas, treasury arrangements for prepaying for things we've never done before. So it's been an interesting ride, and I'm excited to talk about it with this panel.
Great. Thanks so much for that, Allison. Gary.
There you go. I'm going to get that nickel back. So Gary Peterson, I'm the Executive VP of Supply Chain and Production at the O.C. Tanner Company. We're a $500 million global tech company. Our clients are mostly large global enterprises. They use our technology to recognize the great work of their people. And that results in either shipping a custom award that my manufacturing group makes for them, or an award that my supply chain has procured, warehoused, and fulfilled. So some sort of valued consumer good that we send to them. I would say that throughout the pandemic, we've been able to continue manufacturing in Salt Lake and in Toronto. It's about 500 people between those two facilities, and continue our warehouse operations in London and Germany. We also have offices in Mumbai, in Singapore, and Melbourne. all of those offices and everybody from my logistics and buying teams all over the globe are working from home and have been working from home since about March.
Great. Thanks so much for that, Gary. Kim, perhaps you can introduce yourself.
I am the Senior Demand Analyst for ThermoFisher Scientific, and I've just come from GE Healthcare. My job is to send a demand signal to all these great supply chain people. And I this morning sent a $1 billion supply chain or demand signal to my business unit. Now, I love to hear back from the supply chain people. So I love to hear from you guys because sometimes I think that they get scared when they see things from me. But that's my job, is to send a pure demand signal so they know what's going to happen and so they what's going to see in the future. I did the same thing for GE Healthcare, and obviously my focus right now is on the vaccines and the vaccine development and the vaccine distribution. And that's what I do.
Excellent. Thank you so much, Kim. James.
Hey folks, James Sneddon here. I'm the Senior Director of Strategic Sourcing here at Albertsons Companies. Probably some of you know Albertsons. It's a $60 billion grocer headquartered here in Boise. It actually operates under multiple banners. We call them banners. Safeway is one, Albertsons, Acme, Jewel-Osco in the Midwest. So we have about 2,400 stores throughout the country, mostly in the East Coast and the West Coast, and kind of the central Midwest corridor, not so much in the South. And we sell groceries. And as you may expect, this pandemic has just been a really crazy wild ride for us. My team is responsible for what we call the backstage. So this is not food supplies. This is keeping the DCs running that get food and groceries to the stores. So everything from transportation, inbound transportation, maintenance of facilities and DCs, materials to keep them running, equipment, contingent labor, things like that. A whole big swath of stuff that just keeps the back of the stores or the backstage running. My experience is actually in tech. I spent most of my career in Silicon Valley with Intel or Google, places like that, and a very different supply chain experience there than what I'm learning now and what we're doing now. And it's been very fun to see both sides of the spectrum in terms of supply chain and risk and management of that. Looking forward to today.
Excellent. Thanks so much for that, James. So let's perhaps start by going back to, maybe we want to start back in February and March when we first started to, obviously now we're realizing it actually predated February, March, but that's when we started to get a sense of something was coming. And let's talk a little bit about, when we first came to hear about this and we first started to realize that this was a pretty significant event. What were some of the immediate steps your organizations took, initially? And we'll talk a little bit later on about how the year evolved. But as we go back to that first response, what were the first thoughts? What were the first actions? What were the immediate challenges that you all were having to deal with right at the outset? Perhaps, James, we can start with you with this one.
Okay, so first of all, if you ran out of toilet paper or anything like that, I'm sorry. I apologize in advance for everything that was gone. But in all seriousness, our organization had to react very radically and very quickly because we literally had run on things in the stores: food, toilet paper, clean supplies, and my team specifically we had to figure out how to, like I said, keep the backstage running. And so we had drivers that would go in, and we had to have protocols, and we couldn't find hand sanitizers. We had to look for PPE. Suddenly we had to have this interaction with the public, and we had to protect our workers, right? But we also had to protect the public. And so there's this, how do you do that? And how do you figure out, and what do we require? So gloves and masks and face shields and temperature thermometers for when workers come in and scan them to make sure they're not sick. And it was just completely sudden change of how we operate. And finding that supply of those things, I was probably unfortunately competing with people like Allison trying to find the stuff, and they would get, they could get government notices, and they had first under government rules, they had first ability to take those kind of supplies. We literally were kind of fighting over supplies out there in the market. So it was an amazingly dynamic environment, and I think cleaning agents. I mean, who would have thought that suddenly we couldn't find cleaning agents from people like just whatever chemical suppliers. We had to go and look for Clorox, bleach, and that was in short supply. We had to develop protocol to use bleach because only industrial level bleach was available. And so we had to find different concentrations and look for things that didn't require special mixing or special processes in stores. And it was just basically, we rallied around keeping stores open so people could get food. And that was the rallying cry. That was the mission. It was an incredible experience for people to run at.
Excellent. Obviously, for the average sort of retail customer, the first thing that they see is when they go to the grocery stores is what I need there, and clearly it was not, and obviously a lot of factors involved there. Allison, obviously very early on, the healthcare field was clearly sort of sensitized to what was going on. Perhaps you can talk a little about from the perspective of IHC and supplies that serve our healthcare system here in Utah. What was your first reaction, and what was your rallying cry to sort of get things moving?
Yeah, it's interesting because as I think back at the start of the pandemic, actually, we made a significant donation of PPE to China when nobody really understood the scale and complexity and how this was going to still impact us. So we made a sister partnership, if you will, with a healthcare organization over there, and we're able to trade goods at our most desperate time of need, if you will, similar to the staffing arrangement that you hear about in the news, where we have supported New York in their time of need, and now they have nurses and clinicians here. But I think the thing that's really interesting is we feel pretty lucky that we got a little bit of a head start from a supply chain perspective because of the way the pandemic sort of rolled out across from east to west of the country. So more so than our colleagues maybe in New York or on the East Coast, we had a little bit more notice and had an opportunity to bulk buy, if you will. So kind of breaking a supply chain principle, but done for the right reasons. I say sometimes in healthcare, we break basic supply chain practices and over inventory on purpose because it's not a loss of a retail sale, but it's really, a patient's safety or one of our caregivers' safety. And so if we have to carry a little extra inventory, then that's what we do. So if I think back to early on, what did we notice first and how did we react first? I would say our first inclination was to, I don't want to say frantically, but to source as much as we could. We have the benefit of having a warehouse here. That's uncommon in healthcare. I'm not sure how familiar you are with healthcare providers, but they often use distributor partners for just-in-time inventory delivery, which put many of our competitors in a really tough spot because they couldn't stockpile. We had the benefit of the building that I'm in here, and so we started pre-buying as much as we could. From a sourcing perspective, we started identifying alternative suppliers of the same goods that we have today, maybe at different price points outside of our contract portfolio, and then also tried to work directly with the clinicians early on to identify if there were substitute items, like a not normal formulary good that we would use, but would it work for the clinical need? And so we set forth on sort of those activities right from the onset, and that well prepared us so that as opportunities presented for sourcing, that we were able to take advantage of them, having already done the pre-work with our clinicians to ensure that they would meet our infection prevention and other protocol groups here that have a say in what it is that we buy. So I think that's how we reacted first, was gobble up what we can, to James's point. We were trying to influence the market and take what we could on behalf of our caregivers, but also to share with the community through our state collaboration, which hopefully I could talk a little bit more about in one of our other questions.
That's excellent. Interesting, obviously, that, a lot of times, we talk about the strategic use of inventories. We want to try to keep things light to the extent possible, but here's one of those unique situations whereby, inventory is king if you're going to be able to respond to, rapid change in the marketplace.
We've actually rented 3 additional warehouse spaces as part of COVID. And so we have squirreled things away in lots of places on purpose, but they're all moving. So to your point, you're exactly right. It was the right move at the right time.
Great. Gary, obviously the industry in which you operate a little bit different from, grocery and from healthcare, not
Right.
not essential in the same way, but clearly, the notion that you're producing products that are organizations turn to you to recognize their people. A little bit of a different context for you.
So we actually didn't anticipate, nor have we felt much problem on our manufacturing side. We're vertically integrated. We have our own refinery, so we buy raw materials. We make our own alloys. We make the parts we need. So manufacturing was fine. Where we anticipated, and in fact have had major problems, is sourcing of the consumer goods that we send to people. We're in the same battle with retail over the hard to find items, especially those that have surged during COVID, the outdoor goods, the kitchen goods, the exercise products, things like that. People can't get them anymore through retail. They think, well, we'll go to OC Tanner, we'll get them, we'll use our points, and we don't have them either. And we anticipated that. But the tariffs back in the fall of 2019 actually had us ahead of the curve, knowing that the Trump tariffs were going to kick in. We also bought, like Corry was saying, Allison was saying, probably not the best supply chain idea, but we purchased ahead of having to pay the tariffs. So when COVID first hit and China started to dry up with supplying, all these consumer goods, we were a pretty good spot. And we were a little bit smug, a little bit patting ourselves on the back. Yeah, we got this kind of thing. And about June, maybe July, the wheels started to come off because it wasn't just a 3-month, 4-month kind of thing. It was long term. And so we started to feel the pinch then. Even then, we did better than a lot of our competitors and a lot of the retailers because we have really great relationships with our suppliers and with the distributors that provide us product. We treat them as a partner. And what we found was that they were still prioritizing shipments to us when others were drying up. And so we feel really good about our strategy of having good partnerships and good relationships with suppliers. I think it paid off for us, but again, once product is gone, there's nothing anybody can do. And so we started falling apart that way. The other thing that we really had to anticipate was, so we continued to manufacture. And so we had to have protocols in place for the safety of our people. And we worked really hard right out of the chute to define. Of course, in those first several weeks, we thought everything caused COVID. We thought you get it from everything and everyone and everywhere. And so I think our protocols were probably a little bit over the top, but our people embraced them because they felt like they needed to and they wanted to. And the net effect has been that throughout the entire pandemic, we haven't had a single case of somebody catching COVID at work. So we feel really good about what we put in place early on and the impact that it had on our people.
Yeah, you raised a really important point there about the human side of this. And, there are times where you'd like to think you want to err on the side of caution. And hopefully people will embrace that as opposed to the alternative, which obviously would have its own consequences. You actually raised an interesting point there, which reminds me of a conversation I had recently with Blake Watterson, who is one of our alums and is the Chief Operating Officer for Icon Health and Fitness. The point that you made about relationships, one of the things that he had shared with me, a couple of things actually that relate to this conversation. One was, even though they're not in the consumer electronics business, they have the consoles. Right. And one of the things they found out very, very quickly is that companies like Huawei were cornering the market on capacitors and other components, which made it very, very difficult for them to get the components they need to make the consoles. At the same time, demand for home equipment is just through the roof. But the other thing he mentioned, which reminds me of taking back to the comment you just made, was the importance of relationships here, and the fact that once they realized there were some challenges with capacity in China, they were able to very, very rapidly get situated within the space of 2 months, a new supplier in Vietnam, because they already had this particular supplier already had facilities in China. They had the relationships in place. Literally within 2 months, they were able to get a new factory set up and operational to try to supplement the capacity that they needed which has been compromised in China. So again, I think I'm glad you brought that point up there about relationships and the connections with suppliers and partnerships and leveraging those in difficult times. And obviously, if we don't have those in place, then when there are significant supply constraints and everybody's going for the same supplies, you want to have people that you can work with and are going to be willing to go to work for you as well. So great that you brought that up.
So let me tell you the downstream story about Icon. So naturally we buy from Icon because they had great products, and they were helping us out. And we had some clients who said, hey, we want to reward our people with treadmills and other fitness products. Can you do it? We said, absolutely. And we committed to several hundred. And then that was the same week that Icon said, "Ooh, we're in trouble. We're only going to sell our products on our website," and they basically cut us off. And that was like, "Oh no, panic time!" And we begged them. We did everything we could, and they got in a cargo full of product and met their own needs. And they told us they're very sorry, but we had a good relationship. The next cargo that came in was like a week later. They gave us all the product we needed. And again, we felt like if we had not had a good relationship with them, clearly they were constrained. Clearly they had to look out for their own best interest. And it always works out well to have that good partnership.
Just goes to show you cannot just focus on the short term. You got to focus on what's the end game here. What's the big picture? Great example there, Gary. Thanks for that. Let's start a segue into, and I'm going to come to you with this one to start, Kim. Let's start segueing into we've had the initial response. We're now starting to realize this is a thing. This is nothing that's going to go away anytime fast, and we now need to start getting situated for what comes next. Obviously, very early on, conversations about vaccines. Kim, can you perhaps talk a little bit about, once the reality of this set in your role at ThermoFisher, what's going on there as you start positioning for getting that vaccine development process moving and being able to source, to supply to the organizations that are going to be the actual providers of those vaccine products?
Sure. And before I tell you that, Steve and Jill will kill me if I don't tell you all, I'm a graduate of the Huntsman School of Business. So for all you students, there you go. So
nice plug there. Appreciate that.
Yeah. Early on, starting in like December, we saw problems with the China supply system. And then in March, all of the shipping routes fell apart because all the planes and all the freight and everything we moved back and forth from all of our facilities just fell apart. In the meantime, Allison's asking me for PPE, and then the state government's asking me for test kits, but we can't get a supply from China. So that's our first panic point. When I know we need PPE, I know we need test kits, I know we need pharma for vaccines. And for the 2 vaccines you're seeing right now, those are brand new supply manufacturing systems. They've never been produced before. They're not like any normal vaccine that we had before, like MMR. These are brand new setups. So I'm getting this signal for something that is so strange and so odd that, one, we have to start figuring out how do we get things back and forth because planes aren't going. And it's important that Allison has PPE. And 2, how do I support now this manufacturing of the vaccine that I know where it's going, I know where it's coming from, and where do I now get these materials and how do I get them to me? Does that answer your question? That was my first panic point in March. It was all those things combined.
Perfect. And so as you move from that initial point to next steps, knowing that we know about the scale, the magnitude of the issue, and you now have a sense of the magnitude of demand that is coming on the horizon for vaccines. Maybe you can talk a little bit about how you transitioned into that stage of making sure you're producing enough product to be able to support your customers.
Well, immediately we start doing expansion, and almost all the companies that do things that go with vaccines start doing expansion that they can do. And obviously it can't be fast, but the industry has been growing fast enough that there's expansion plans that have been in place, but now they ramp it up. And they ramp it up in a serious way because they know that this is going to be a really big deal, especially for the vaccines. And I don't know, we'll get into the bottleneck of vaccines later, but they start moving that expansion. They start trying to kind of like Gary, stockpile materials that we know are coming. The other thing we start doing is I send a signal, and the supply chain sends a signal that we're going to expedite anything related to COVID. So even though we're making all the other pharmaceutical products and all the other things we normally do, we expedite everything related to COVID so it increases and is faster. So we're expanding. We are making sure COVID goes first, and we are stockpiling. And that's what we start doing in March and April.
Great. Let me turn that same question over to you, Allison, because obviously as we get past that initial reaction, the healthcare field very, very significant, very, very rapidly saw the impact and some real sourcing issues there. Can you perhaps talk about from your organization's perspective as we get into the summer, what is now starting to change in terms of changes in procedures, changes in terms of work processes? Now that you have a sense of where the bottlenecks are, what are you now starting to do to guarantee supply?
Sure. So in addition to trying to stockpile, we really looked at how do we control our burn rate, because for perspective, we let's just say the magnitude. We used to use 100 of the N95s, a week or whatever as a system, and now we're using like 150,000 in the same time period. It's not quite that dramatic, but it is a significant change in our utilization. So our initial thought went to, okay, we've stockpiled what we can. How do we affect the burn rate, if that makes sense? So we made the decision as an organization, as did many health organizations, to stop doing elective procedures and elective visits. So that really forced us into a fast digital adoption of many virtual visits. So if you went to the doctor at any point during that time, in all likelihood, you probably had at least a pre-screen that was done as a video chat, because that allows us to not have to use PPE for every episode that we were able to provide care remotely using our virtual tools. But also that means that many thousands of people had surgeries that were delayed that they had planned their lives around, which is, very disruptive, because we needed to make sure that we would have PPE for COVID patients and not burn through it for using it in regular elective or by choice, if you will, surgical procedures. So that was one area. I think the other thing that we recognized pretty quickly is when we turned off the elective procedures, we have a lot of clinicians at facilities that aren't open or weren't doing anything, like any ambulatory surgery center or our clinics. So what could we do with those individuals? So perfect example, a face shield that usually costs us about 85 cents. We were now being asked to pay $12 for a similar alternative product, which was probably nicer, but not something that we could use quite as interchangeably at the $12 price point. So we did two things with that. One, we used the displaced caregivers to come to the supply chain center here. We used our sign shop to produce the materials, and they assembled face masks. So we put back our team to work so that we didn't face layoffs or could delay them as long as possible, and had them assembling face shields so that we could be competitive and have the PPE supplies that we needed, because we weren't getting it from our traditional supply chain source. And the alternatives presented to us were significantly more expensive than that plan. I think the other thing that we did was look at reuse strategies. What could we do to not make our utilization single use, single patient, and how could we safely, for both our caregivers and our patients, look at those. Can you use the mask for the entire shift? Can you use the mask for multiple days? And we actually stood up a process where we gave our caregivers a set number of masks, and then they would get their own mask back after having it sterilized through a peroxide process, a gas cleaning process that we use to re-sterilize it. Now, it's not perfect. You can't do it forever, but you can get a couple of extra uses out of it. And that really prolonged our burn rate and really sort of taper down the speed at which we were going through the PPE that we had stockpiled. So that's sort of where we hit in the early summer, midsummer stride, was how do we slow down our utilization of what we've already got.
Excellent. Thanks for that, Allison. James, let me turn that over to you. This, essentially the same question. As we move into summer, obviously in some areas of the grocery sector, things started to settle down. There was obviously the initial rush to hoard started to pass. There was a little bit more of a sense that, okay, we can actually deal with this as long as we work together. What were you seeing in the grocery sector as people, got past that initial reaction to the COVID and realized this was going to be an ongoing phenomenon?
Yeah, I think interestingly, some similar dynamics. A big part around PPEs. Once we secured at least that emergency supply of it, and we did some stockpile like everyone else did, we really had to. We looked for the longer term supply chain of those things, and we had to develop processes in terms of their use. We found, for example, because we have a lot of people interacting with the public, there were certain kinds of face masks that could not be used. We also are a big distributor of medicines in our pharmacies. And so because N95 masks are much more at higher risk and the healthcare workers get priority for those in terms of the allocations in the market, we changed the use of how we have masks. We allowed pharmacy workers who interact with the public and may be sick to have N95. The rest of our workers can do cloth masks or paper masks or whatever we could find them. We also found our environments that different types of scenarios require different PPE. We have a lot of workers in distribution centers and freezers, and they would, masks would fog up their glasses very quickly, and so it was dangerous. And we had to look at face shields, and we just had to really evaluate operationally what was working, what was not, develop protocol for what was working, what was not, and be able to change and tweak. Contingent workforce became a real factor. How workers come into these DCs, they're like small factories that have thousands of workers in there. And we found out that, carpooling, we had carpooling break out COVID with people, which we went into a distribution center, and we had a big pocket, a hotspot in one of our DCs that shut down a big portion of the DC. And so we had to look at contingent workforces and be able to pull out, whole groups of employees to quarantine and cleanse, bring in contingent workforce to keep things operational and look at training for those folks beforehand. And just all those different pieces had to be very fluid, very dynamic. I think one of the themes that I'll learn and I'll express routinely today is a willingness to reevaluate and evolve and change what you're doing today, because it may not meet the needs tomorrow, and we have to do that even now, frankly.
So something, I want to sort of, maybe take a pause in terms of going through the year just for a second. So Gary talked earlier on about the importance of supplier relationships, and Allison, I know you and I have talked earlier on about the people side of this. How do you actually lead in these challenging times? Maybe we could just, spend a little bit of time, looking at this issue from a internal organization, from a people perspective. How are you managing in your organizations the transitions in terms of the nature of work, making sure people are in a good place to be able to meet their professional responsibilities while at the same time they're dealing with a lot of challenging circumstances outside the office? Maybe we start with you on that one, Kim, and then we'll maybe have the others on our panel maybe speak to that issue as well in terms of your own internal, human capital strategies.
Sure. The manufacturing sites that actually make the products that are in the sterile clean rooms, those were the people we had to make sure were COVID-free all the time. And obviously ThermoFisher has testing capabilities because we make the testing kits. But that being said, those people have to be COVID-free all the time. And if we get one COVID case, the entire manufacturing line has COVID. And that's a huge problem for vaccines. It's a huge problem for Allison. It's a huge problem for James, because we can't provide that product. So number one is the safety of our employees. Number two is there are people like me, because I've only been actually at home for a week now, who work better at work than I do at home. And I know that's not true of everyone, but it is for me. I'm home now because the case counts in the facility where I work are up. So they're making sure that nobody is bringing anything into the facility at all. The leadership goals that we get from all the manufacturing sites are, you take care of those people who are directly impacting the product that you're making. And that's the number one priority. Everyone else, you go home, work from else, figure out how to do it right. And then the bosses have to figure out, how do we make these people happy? How do we make them work effectively when they've never worked at home in their lives? Those are the concerns that we had. Does that answer your question?
Absolutely. That's a great insight into that. Allison, maybe I turn that question over to you, because I know that's, as we've talked about previous to today's session, obviously how you manage your people is a huge part as a supply chain manager of your role, even more so in the current circumstance.
Yeah. So interestingly enough, I would say most of my team had been taking part in a telecommuting program that we were piloting at supply chain actually in advance of COVID. So we got the benefit of last summer really starting to telecommute a few days a week. Now, what does that mean? That means we already had laptops, we already had screens, we had equipment at our homes so that the team was fully equipped. So making the transition was more of the angst around Kim's point of how do I manage my work, less about the technical tools. But I do know that for other parts of our organization that wanted to adopt telecommuting and working remotely, it became problematic because we didn't have the equipment or the tools, and everybody was trying to get laptops to replace desktops, if you will, in these areas where no one ever thought that they were going to be remote. So I guess the only other thing that I would add is, it's a scary time for our caregivers. There's a lot of uncertainty, a lot of anxiety, both personally about their families, about their friends and other caregivers, and then also what's happening at work and does this impact their lives? And so I guess the one thing that I've always tried to lead this way, but it's really been more pronounced since the virtual workforce became a part of this and COVID, is the spirit of transparency. So we spend a lot of time on our calls, especially our leadership calls, talking about the importance of being transparent with the frontline caregivers, helping them understand that there are times that we just don't know either. And, it's kind of a vulnerable position when, as a leader, you say, well, I don't really know. And that can be seen as a weakness or insecurity, but really trying to affirm to the team that we're being as transparent with the information that we have, that we understand and hear their concerns, and that we're doing all that we can to help mitigate those together as a collective group. And so that's resonated really well with the team, but it is a shift from what I would say is, a culture that's been in place for many years and, very, trying to think of the right word for this, but very formal. And oftentimes we didn't share things if we didn't have all the answers, or, announcements would be made, and no pre-communication had gone out. And so we really have just tried to trust in our caregivers and talk to them and say, hey, this isn't public information yet, but you will be hearing this announcement from Intermountain that we're going to be canceling elective cases, and trying to help them feel like they're part of the decision, or at least in the know in advance of a major announcement. And that seems to have really helped with our ongoing engagement of the team, and kind of keeping spirits up that we collectively are being, as open as we can about the situation, knowing that there's a lot of unknowns still to this day about how long this will last and what shape it will take in the coming months.
Excellent, thanks. I appreciate that insight. Gary, let me turn it over to you for a second. I'm actually going to sort of throw a couple of pieces at you, because I think, your organization is, all of the organizations represented are very unique. But the point that I want to play with here with you and OC Tanner is that obviously OC Tanner has a history and a reputation of having a very, very strong people culture. And so perhaps you can talk about, as you think about these last 8-9 months, are there some particular things about that culture that have served you particularly well, but also are there some things that you've had to do differently, despite the fact that you already have that culture in place, that have helped get your organization through these last several months?
Yeah, no, that's a great lead up there, Vijay. We decided very early on that we were going to dramatically increase our communication, and one of the ways we've done that is every single day, our chief people person, we call it our leader of people and great work, Mindy Cox, she sends out an email every evening to all global employees and just kind of updates them on what's going on. And they're good. She's very talented, and I couldn't have kept it up. I've got pretty good stamina, but I couldn't have done this email every day that she's been doing. And I've been astonished at how it's been received. Everybody can't wait to get it. They talk about it. In my teams, most of whom do not get email, the production teams, they read it together in the morning. They talk about it. And I think that has been incredibly helpful. We have had many more town hall meetings, virtual town hall meetings. And it's interesting as we just candidly talk about where we are, where the profits are, well, it's where the sales are, what we're doing to respond to it. The kind of chat things I see flowing down on the side are incredible transparency. Thanks for being so honest with us. Thanks for telling us what's going on. And I think that has definitely shown a trust in people and helped people continue to trust leadership. The executive team, we used to meet once a week for a few hours. We've been meeting every day since March. And it's been an hour to an hour and a half. And it's interesting. It has been so much better at helping us get aligned with each other, making sure we're all saying the same thing all day long. We're all got the same message. Everyone knows what's going on. So there's far less confusion throughout the enterprise globally than I think there was before. And then the last thing I would say is that I've always had a daily huddle with my executives. I have 11 directors and VPs located here in Salt Lake. We've always, every morning at 8:45, we gathered around our huddle board and around our screens and just talked about yesterday, talk about today, talk about tomorrow. And we've been doing that the same 15 minutes every day, but it's all virtual. What I've noticed is that that meeting has had to become much more purposeful in terms of everybody trying to listen better and question and understand. In the old days, you could leave the meeting, you could catch somebody and clarify a point, or you could pass somebody in the hall and work something, or you could go and see what someone was talking about. Now, I mean, I noticed the intent with which everyone is focused for that 15 minutes is much stronger. And I believe that's happening all the way down. All of our teams huddle for 15 minutes every day. They have a team meeting for a half hour every week. And I think all those meetings have become more full of intent and purpose that allows the communication to be more effective. So that's what I would say.
Excellent. So let me ask, again, a question which I think really is unique to your organization. Obviously, you're in the employee recognition business. And obviously, as we think about these last 8-9 months, how employees react, how they respond is going to hopefully translate into down the road organizations trying to do everything they can to recognize and appreciate those contributions. It may be early, but are you starting to see any ripple effects of that for your own business?
Yeah, actually, it's been amazing because, when everything first shut down, our business immediately dropped off 15%, which is a big drop for us. And it stayed there for 3 months. And we thought, okay, this is where we're going to be long term. This is going to be very painful. But then I believe what you said is true. Companies started to realize, hey, we have got to get our hearts and minds of our people engaged. We've got to help them. And our sales started growing, and they've just been climbing remarkably ever since then. They haven't stopped. We're going to finish with the best second half of the year in terms of growth that we've ever had. And I think it's because of what you're saying. I think people are realizing somehow we've got to engage our people better.
Yeah, excellent. Thanks for that. That's it's obviously we're going to come to the end of this, but obviously we want to know that organizations are coming through this and are going to sort of prosper, when we come to the end of the tunnel. So appreciate that insight. Let's maybe move forward to kind of where we are today. Obviously, there's been a lot of learning that's been taking place over these last 8-9 months. And perhaps maybe we start with you, James, as you think about your organization today, in light of what we've seen over the earlier part of the year, where is your organization today in terms of being positioned to move forward from where we're at?
It's a hard question because, frankly, we're still evolving. I think that has been one of the key themes I think our organization has developed, is this view of how we need to operate and how we need to keep evolving that operation. And so I would say that's where we're at. I'll actually use the quote from our CEO. We were I happened to have a meeting with him. The whole supply chain team did, and one of the things he mentioned is every day when he wakes up, he gives himself the permission to change his mind on a decision he made the day before. And so we just have to continually evaluate, because we have so much interaction with the public, and we have so many, we have 200,000 plus employees that can bring COVID into a store, that can give it, in fact, a customer. We have to continually look and evolve. And so it's extremely dynamic. The supply chain seems to be more stable, but we're always still looking at the contingent workforce piece of it. We're always looking at protocols to see if we need to tweak them. We're always looking at the supply of cleaning agents to make sure we have the right things in the right places. I would say it's not solved. It's kind of the mindset. We constantly are assessing, what do we need to do next? Is there something we've missed? Is there something we need to tweak? And the culture piece, many people talked about that. I think we're finding that we're working very well remotely. That was something that culturally, this company had none of that really mindset whatsoever. And we've actually, as a company, been much more productive working remote. So we're evolving that culture. We're trying to find ways to communicate better. Meetings and the kind of information we share, has been mentioned by others, that's happening regularly. We're doing a lot of team building online. We've done surveys to analyze which employees prefer to be in the office versus which prefer to work from home. We're going to be developing a hybrid model so people can kind of have a choice, and meeting protocols that include everyone depending on how they prefer to work. I mean, this is where the organization is going, and I think many companies are doing that, because in my particular view, you're going to be able to recruit talent from anywhere now. And you're seeing that more and more, that good organizations will just get talent wherever they're located geographically and integrate them into their workforce. We now have 3 or 4 new employees from Atlanta, Georgia, that don't live anywhere near us, and they're going to remain there. We have one from Texas. This is how we're evolving. This is how it's going to go. And that's good. And so, again, it's dynamic, but we just have to keep that kind of flexible mindset, that nimble mindset.
Excellent. Great point there about the need to be flexible and agile. And, I think there's one thing that we've learned from this year is that, things can happen, and we need to be positioned in a way that we can respond. We're not going to get it right, but we need to be able to respond in a way that's effective given the constraints and the circumstances that we're faced with. Kim, let me ask you the same question. Obviously, I imagine in the coming months, ThermoFisher is going to be particularly busy now that we're into sort of the large scale vaccine production stage. What's your sense of where the organization is today, and in light of what's been learned over these last few months, where you are, how well you're positioned as we look at this next phase of the pandemic?
That's a good question for me, since I send the demand signal out and it's my job to analyze what's coming up. So we do an analysis. Well, let me first tell you that when we first started doing this whole demand process years ago, we did a signal once a month. And now we're doing a signal once a week. So to James's point, things can change day to day. That being said, we've reached the point now at ThermoFisher where we know that for the next 6 quarters, we're going to have a COVID effect in addition to our regular effect. So we've done analysis on both ends, what the COVID effect is versus what the actual is for our normal procedures. So we are planning for whatever exponential growth we need for the next 6 quarters. And that is being planned. I mean, as of today, it's being planned based on the signal we just sent. So Thermo right now is very, very proactive in making sure that in 6 quarters, we are fully set to handle anything that the country and world may need.
That is very reassuring to hear, because I know it's going to be for companies in your sector, it's going to be quite a challenge over these next in the next coming months. Just listening to the latest reports, obviously, first responders access to vaccine probably this month, but we're probably not going to be at the point of wide scale availability, at least from what I'm hearing and reading, probably until the latter part of the spring, if not the summer. And obviously, people are yearning for that because people want to get back to normal, or whatever that means. I'm not even sure what that means at this point, to be back to normal. So let me do this. I got a couple more questions that I would like to get a response from each of you on, maybe possibly the most challenging questions so far. And then what I want to do is, I know there have been some questions coming through in the chat, and we'll turn it over to our audience and get their questions. But the first question I have for all of you, and perhaps Allison, we can start with you on this one. In retrospect, as we think back to the early days, and now we're wiser for it, in retrospect, what are some things that you might have done differently as an organization?
Wow, that's a loaded question in a lot of ways. I guess the thing that I would say from my seat that we would have done differently is more quickly collaborate with other healthcare organizations or non-traditional healthcare organizations that we don't have to help the community in a different way. So let me help explain that. The state of Utah, under the Department of Health and with FEMA and others, stood up a working group that really had the potential to be very impactful, but by the time we got it sort of stood up, I don't know, I think everyone already had their own plans, if that makes sense. But it was interesting to watch, and I guess I wish it would have happened sooner, the acknowledgement from our local EMS and jails and long-term care communities and homeless shelters and healthcare providers that we were going to need to address the community need together, because if I don't donate PPE to the long-term care facility that can't buy any right now, every breakout that they have comes to me in the way of census anyway. So there's a preventive element that we can do better as a community, if that makes sense, in the way that we serve that. So I wish we would have had that acknowledgement earlier. And it's really interesting when you step back and say, hey, these 4 health systems that are normally your competitors, we are now all in this together. Let's be transparent. Let's pool resources. Let's share. You need this, I need that. Let's swap things that are, not traditional business practice, just being competitors. But I really wish we could have stood that up sooner with that acknowledgement, because I think we had a lot of ability to help guide where the CARES Act dollars were spent and what they were spent on, for example, or helping educate some of the smaller health systems, with some of the analytics tools that we stood up to understand where and what we've got and number of days on hand, that they were able to use those tools and just sort of adopt them. And that didn't cost us anything to share that. And it frankly doesn't impact our business, but it was the right thing to do for the community. So I hope that if and when this happens again, that we can wear our community hats more quickly and maybe even take some of those lessons into our day-to-day work, that being a competitor doesn't mean we can't help each other.
Excellent there. I mean, I really appreciate the candor of that response. I think I would have been a lot more concerned if you said, oh no, we nailed it.
I actually, if you have time, I have quite kind of a funny story about hand sanitizer. So this work group that got pulled together, the state procurement group helped to chip in on sourcing because they were going to help with this. But I remember vetting all of the ideas that they came forward with hand sanitizer. And so I just remember the first offering they came with didn't fit in our wall containers, right? So you forget, like, it's not just that it's hand sanitizer. It's like, it's got to be in this shape or this bag or this thing that has this doohickey on the bottom so it fits in the thing, right? And so then we ended up with desk ones. It's a long story, but then they came with a second offering, which was a really different mix of alcohol than we've used in the past. And not in the hospital so much, but our community health EMS partners had some real concerns about that, because there are unfortunately people in our community that will steal that and try and drink it, which is not really healthy. But that mix of alcohol was really relevant from that thing. So one more thing to think about. And I sort of caved in on the last one when they brought to us, they were going to source 55-gallon drums. Now, I mean, do you know, like, that's ginormous, if you will, of hand sanitizer. And I said, that's great, but how am I going to get this to the nursing units? Like, what am I going to do with this? And they're like, oh, well, you just put it in bottles. And so I'm like, all right, time out again. People really well-intentioned trying to help, but, they don't have bottles. We don't have a way to fill it. I'm like, it's alcohol based, so we have to have a hood and a special room to store it in, to transfer it and into bottles that don't exist. So it's just really interesting when you sort of think through again, well-intended people. Everyone I know called me with somebody that they know that has PPE that's actually legitimate and certified and that they're going to sell it to us. It's just a lot of noise. And I think the lesson or takeaway is if we can be very prescriptive about what it is that we need, others can help us. But otherwise, it just turns into this constant triage process that my team was doing at first to say, thank you for your help. I really appreciate your research. That's not going to work. I'm really sorry. Here's why. And then it just became this iterative cycle. But that's one of my favorite stories of how we're going to get hand sanitizer and if I'm going to have to buy it in a truckload or not. And I'll just let all the nurses take a dive through it on their way to the floor. We'll just slip and slide style and just immerse them in, I'm just teasing.
So that's a great example. It actually reminds me of one that I remember coming across earlier this summer of an organization that, in order to encourage kids to be using hand sanitizer, they put the sanitizer in one of those pouches, kind of like the single serve drink pouches, and it had kid cartoony characters. And there were a few instances where people thought it was a drink and not hand sanitizer, but the intent was, how can we motivate and get kids excited about using this product? You know what? Great opportunities for us to learn. And that's, I think, what we need to really be thinking about hard here. Gary, how about for you? What might you have done differently? Is there something that you can point to that sticks in your mind?
Yeah, no, we totally nailed it, BJ.
I expect no less from OC Tanner.
No, I think several things. One was that we had bypassed some really good brand names, US made brands, because of the price. And so we were looking for similar products that we could source for less expensive overseas, for example. And when it came time to switch out to, we had to use some US brands when the Chinese sourced goods dried up. We didn't have the relationships that we needed to leverage that. We have now added a lot of new brands, which I think will serve us well in the future. I think we're going to be more cautious in the future about being so cost sensitive at the exclusion of good products. That was one big insight for us. One place where I think we did nail it, I think there is the possibility of a cardboard shortage coming up here in the next few weeks. And we saw that coming and we did nail that. So if that happens, we'll be sitting comfortably on our stack of cardboard. I think also another thing we noticed was that our purchasing analysts and buyers, they're perfectly content with a lot of their manual processes. We had tried to automate some things, put some bots in place, and they just didn't trust it. They didn't want to do that. They thought they were smarter and so forth. And now that they've had to do so much manual work, swapping out old products for new products, moving things back and forth, they realize that we wish that we had put those things in place a year ago, 2 years ago, 3 years ago, because they are doing so much work now that is unnecessary just because before they didn't notice that it was a problem. I would also say that the need for better vendor integration has definitely showed up as a very serious issue. We've been too manual there, putting APIs in place, for example, vendor feeds, whatever. Those would all be, we're really chasing those aggressively now. That would be good. And then the other thing that we haven't talked about yet, if you've heard the term Shipageddon, we are in the middle of Shipageddon. All the carriers are putting limits on how much they'll pick up from us every day. And all the trucks that you see on the streets, FedEx and UPS are driving Penske trucks and U-Haul trucks, and now private vehicles are going to be putting products on your doorstep. We are definitely constrained with all the demand for product being shipped to homes right now. And that is probably at the top of our list of problems we're dealing with for the next 3 weeks. I think that'll probably end about the 20th of December. Is what the shippers are telling us, but that's a very big deal in supply chain right now.
Well, let's just make sure that by virtue of you getting your shipping capacity there, you don't take anything away from James and Allison's organization.
This is a good case of every man and woman for themselves.
I was listening, Gary, and thinking, wait a minute, I know who the culprit is right now.
So let me turn that over to you, James, again. Anything that you can think of that you might have done differently?
Yeah, this is a hard question because it's not like there's nothing that we didn't fail on. But it's also, I had to step back and look at, frankly, I looked at it not only from this experience, but I kind of looked back in time at other, I'll call it, catastrophic supply chain events that I've experienced. And I think one of the things I really decided is, by definition, when you have a really challenging supply chain issue, it's probably something you didn't plan for. It's probably something you didn't think about. And I think most robust organizations do a lot of supply chain planning and contingency planning and look at alternate sources or whatever the case may be. And so it's the stuff that catches you off guard that really, kind of hits you in the face. So how do you plan for that? Because you missed it somehow, right? You can't really plan for a pandemic. You can't plan for a border to shut down because some government says we're not going to export something, which is happening. And I've decided that the organization creating that nimbleness, creating that flexibility, creating a culture that really espouses change, and allowing people to feel comfortable in unknowns and change. That's a cultural thing that I would want to do differently. And I think maybe part of that is, listening to everyone in your team for good ideas, even if I'll call it embracing failure. Good ideas that may go bad, but you still want to have all the ideas come forth so you can change, so you can see what else can be done differently. Kind of just routinely evolving yourselves, whether it's internal stakeholder requirements, whether external market requirements, being willing to continually kind of tweak that model develops a culture that when you really have to do something radically different, like we suddenly were sourcing stuff we'd never bought before, you can get behind it. That is the takeaway I've learned is you got to develop a culture that's really able and willing to quickly and robustly move itself in a different direction, very dynamically. That to me is the biggest kind of takeaway.
Again, the culture part of this is so critical. I know a lot of times we tend to focus more on the actual moving product, moving materials. But again, if that underlying culture is not there, that understands and is able to respond quickly to change, that is going to be a huge impediment. Let me go to the last question. I'm going to start with you on this one, Kim. And again, we've already heard a lot of things this morning about things that you are doing now. The question I have here for the panelists is, is there, over and above what's already been discussed, is there something that you can point to in terms of what you've had to do differently that you see enduring and becoming part of your standard business practice going forward?
This kind of goes back to their question, what we did wrong. But what happens now is that we truly believe in the data. And not only do we truly believe in it, but we work with the supply chain so they believe in the same data. So if I just send them a signal saying, you just have to buy this, that's ridiculous. You have to work with the supply chain and say, this is what we're doing. This is why we're buying it. This is what is happening in the future. This is why this is so important. That's not what we did at the beginning. And that is what forever I will do. I mean, I will talk to the person who's in charge of sourcing every day for the rest of my life, because that communication with him is what I didn't have in March and what I do have now and what I want to always have forever.
Great. Thanks for that. Allison, how about you?
Well, I don't want to be redundant to what I put in the chat, but I think telework is here to stay. That was something that we had sort of partially adopted. I do have some longer term concerns about our ability to collaborate and have team identity in that, but we will continue to work to morph to that new standard, as I believe. I think the other thing that, on behalf of the broader organization, telehealth visits are not going away. So you will continue to see a much larger footprint of your healthcare needs and services being met via iPad to FaceTime sort of like chat, if you will, which is frankly more convenient. You can take those anywhere. And I think that's here to stay as well.
It's interesting that you said that. So just a couple of days ago, I was supposed to come down to Murray for a consult. And I said, look, seriously, you want me to drive 2.5 hours down, 2.5 hours back for a 5-minute visit? And I said, can we do telehealth? And they said, well, this doctor doesn't do telehealth, but he'll call you. That works. I'll take it.
I'm surprised to hear that. But either way, I think it sort of depends on specialty. Obviously, as we have additional needs for labs and things like that. But I think it's really interesting as you look at the telehealth footprint. I envision a day where you get your labs locally and your tests, but the person that's reading them and the expert in whatever it is type of care that you need or specialist in that space might be based in Alaska, but it doesn't make any difference to us if they're the specialist in that particular care, then that's the case. And just by way of the group, I keep telling my boss that I'm moving to Belize and that I will be keeping my job. And at this point, he doesn't have much to say other than, well, can I come visit? So I think we're going to be in a world, as James was saying, where it doesn't really matter where you live. Our talent's going to move, and we're going to be looking at talent in a very different way moving forward.
Just a couple of days ago, the CEO of Zoom mentioned that in future iterations of the Zoom product with artificial intelligence, they're going to make it possible that you could actually have something akin to a physical virtual handshake, and you'll be able to smell the coffee and your office aroma as part of your Zoom meeting. So it's forthcoming attractions there. Gary, how about you for your organization? Is there something that you can point to that is going to become a part of standard process for you as a result of these past 9 months?
Yeah, I'd say two things. First, keeping with this telework theme, not just she mentions working from Belize. I mean, I have people in Melbourne, right? I have people in Sydney and Mumbai. I'm not going to be as quick to jump on an airplane and fly all the way around the world to be with my people. I don't think there's going to be the corporate appetite for that expense. I think it's going to be years before the travel industry comes back, quite honestly. Even simple trips across the pond to Europe, I just don't think it's going to happen as much. My wife is rejoicing. I'll be home more. She thinks that's awesome. The other thing that I think is, I believe, despite the conversations that we've all four of us have said that, we stockpiled some things. That's not a very lean practice, and we all apologized for it as soon as we said it. We know it's not good. I quite honestly, I think we would have totally failed in both supply chain and manufacturing if we were not as lean as we are. I think it just reinforced the importance of good processes. This belief in ourselves, the ability to be agile, continuously improve. I have seen us leap through hoops that I don't think we could have done 15 years ago with the old organization. I think we required kind of this more agile, lean way of being that allowed us to survive and thrive during this pandemic. And it definitely be with us to stay. We'll get better and better at it.
Great, thanks for that, Gary. And finally to you, James.
Yeah, I think maybe a couple of quick hits. I totally agree that this work remote dynamic is going to continue, and probably to a very large degree in some organizations versus others. But that I think is going to be with us to stay. Some other elements I think that are probably coming. I happen to also kind of work with a student body and advisors in UCSD down in Southern California. And they're doing some research on what they call post-globalization. I think that's coming. There are a lot of companies who are going to be looking at ensuring certain pieces of the supply chain are more local, more relationships are more tight, integrated, and cost is not going to be the deciding factor. I would argue it never should have been, but I think people are clearly seeing that there's other things besides cost that can affect the supply chain. So those are a couple of the key things, and then I think. Maybe the other thing for my organization is this constant change piece. We have to continue to evolve. You're going to see, for example, I think going forward in our stores, sanitizer is probably going to remain. These clear plastic divided between cashiers and people that buy groceries, I think that's going to stay. I just think, folks, there's some elements of both health and other safety dynamics that people like. They feel more secure when they go in the store. People have gloves on. I don't think necessarily masks going to stay. I think a lot of these PPE dynamics are going to be with us probably for the future.
Great, thanks for that. That's interesting that both you and Gary have spoken to this issue of the trade-off between cost and efficiency versus agility, and that's an entirely different. We'll keep that for another conversation because that's a huge conversation in and of itself. And I know more broadly within the supply chain sector, those conversations, even though we've been having them for a number of years now, I expect a lot of those conversations are only going to accelerate in intensity as we think about the aftermath of this last year. So I see we have quite a few questions that have come in through the chat, and I'm going to sort of try to get through as many of these as we can. First one here from Addison Chandler. What was plan B if suppliers couldn't get, for example, PPE, treadmills, et cetera, out? Who wants to take a stab at that one?
So BJ, I think actually Greg and I have responded in the chat to the questions. So some of those extra comments there might be responses, not additional questions.
Okay, great. We'll go with that one. Steve, I know Steve's on the call. Steve, are there any questions that you've been looking at the chat that we've not yet attacked? So I see another one here. What is the most significant change from COVID that appears to be permanent? I think we've already talked about that in our conversation. Plan B, we've talked about that one. Let me go down here. Okay, let's see. Okay, here's one which I think will be interesting. Is your job in supply chain management different than you expected it to be?
How do you see?
One here. What is the most significant change from COVID that appears to be permanent? I think we've already talked about that in our conversation. Okay, I didn't quite catch that one. Was that you, Steve? So let me go ahead and go back to this question again. Is your job in supply chain different from what you expected it to be? Are you glad you decided to work in this field?
I'll answer that. I'm sorry, go ahead.
No, I love my job. I love doing demand analytics. I love looking at the differences and the changes. I am fascinated by it. The more change that happens, the better my job is. So I love it.
I'll echo. So I'll be honest. I was one of those who started off with ideals of being in marketing, and I did an internship at Intel, and they put me in a job. They basically offered me a job, and they didn't tell me what it was, and I ended up in supply chain, and I did that for about 6 or 8 years, and I went back to marketing, and I enjoyed it, but I came back to supply chain. Supply chain is incredible. You wear more hats probably in this function than you will in any other kind of job you do. And you have to have real business acumen, to be quite frank, that a lot of folks don't appreciate. It's a fabulous function. I can't give you a thumbs up more.
It's funny. I started in marketing too, James, and moved over to manufacturing and supply chain. And it just feels like we are making all the wheels turn. We're making everything happen. And when you do that really well, it really shows up in a time like this. Back in a company meeting that we had in July, our CEO said to the company, "This is the year of the supply chain." I mean, that kind of sums it up. Supply chain really has had to come through in this difficult time. I've loved being there.
It's a very underappreciated discipline, frankly. It's not as I'll call it sexy as some of the other finance and whatnot.
Yes,
but I'm actually, so my organization's new to Albertsons. Believe it or not, a $60 billion company didn't have a sourcing organization until a year ago. So we're standing it up as we speak. And our CEO said, "I can't imagine what would happen to our company without supply chain during this pandemic." I can't either. Can you imagine what would have happened to our ability to supply food to stores without people sourcing sanitizer? Allison, I've been there with big 55-gallon drums, by the way. Masks, all this kind of stuff. It's amazing to think companies don't operate with this function. I can't tell you enough how important it really is.
Okay. Allison, I know you're chomping at the bit on this one.
Sure. So two things, I guess. By way of background, I have an MHA and an MBA. And so I was always leaning toward healthcare. So and it was somebody way smarter than me that said, just because you don't want to be a doctor or a nurse doesn't mean you're not still called healthcare. And so I very much had been moving in this healthcare lens. And I remember my very first internship in graduate school, I went and in strategic planning and marketing, and they ran out of stuff for me to do in the summer. And so they sent out an email and said, "Who wants the intern for the rest of the summer? She's already paid for." And the guy in charge of supply chain said, "We'll take her." And that was my first foray into supply chain. And I love it and I'm very passionate about it. And I agree with you, all the comments that have been made, that it really is emerging in importance and understanding. And I think for the first time ever, my family and friends have an actual understanding of what I do now that they've understood the complexities that we can relate to PPE, for example, and the challenges. So I left a job a year and a half ago in Missouri and sold my home and like left my family and friends and was traveling full time in Big Four consulting. So on a plane every week and doing the quintessential gig there, left that job, moved across the country, and then was in charge of PPE in my first year in my new job for a very large health system in Utah. So it's been an interesting year and change, and not at all what I expected from my first year out of the role, but I couldn't be more thrilled to be here. I think like my skill set has really added value, and there's not much better that you can feel when you feel like you've made a difference, especially in the middle of a crisis. So I look back at my colleagues and I sort of miss traveling a little bit, but they're not traveling either. So I guess all of them were destined to go through this change, whether they knew it or not.
And we so appreciate that you made that switch and came out here and helped us here in Utah with the whole healthcare organization, Allison.
Thank you.
So what advice do you have for students wanting to work in supply chain?
Ooh.
Okay, this is my big piece of advice for anybody and anything. Don't think that the little nitty-gritty things are the most important. Understand the process and understand how things work, because just because you don't know R doesn't mean you can't learn it at work. Understand the bigger process and how to critically think, because I started in finance, just like Allison started in something else, and I'm a demand analyst. So if you want to do supply chain, which is fantastic, just learn the broader picture and don't focus so much on the nitty gritty, because you can learn that later. Does that make sense, BJ?
Absolutely, it does. I think it really speaks to the importance of being willing to constantly learn and not putting artificial constraints around your knowledge and skill set. I think it's a very, very relevant point to make there. Thanks for that, Kim.
Exactly. Thanks, BJ.
My advice would be to, I said before that supply chain allows other things to happen. And I would think that the advice I would give someone is don't think so much about how do I succeed, what is best for me, but kind of get an outward mindset and approach your job from the standpoint of how can I help other people be successful? Meet with your customers, meet with your peers, meet with your direct reports, meet with your boss, and just get to the nitty gritty of what is it that I do that helps you succeed? How can I do in my job something that helps all of you be better at what you do? And I think that's just a great practice for life, let alone in supply chain.
Excellent advice there, Gary. Thanks for that. So here's another question on a different theme. How do you see the current situation shaping the logistics industry in the medium and long term?
Can we talk about cold storage shipping? Right now, that's the big hot topic. And there's a whole cold storage supply chain system. I'm sure they are beyond overloaded. So in the medium term, if you want to ship something cold, I would be way proactive on that. That's my short term, medium.
Any other thoughts on where, to that point, it's interesting, even here at the university, an email went out just a couple of days ago asking folks, do you have, particularly in research labs, do you have capacity so that the university can make sure we are supporting the effort here in the state? Other thoughts on where logistics goes from here?
Yeah, I can give you a thought. Halfway through the shutdowns and everything, the use of e-commerce was going way up, and everyone was saying, well, it's temporary. People don't want to do this forever, and after everything ends, everyone will go back to shopping, doing their own shopping. And I don't think that's true, especially since it's lasted so long. People are now in a new mode. I think there will hardly be a drop off in the use of e-commerce, the use of grocery pickups, grocery deliveries. It is the new world. And the stores that are going to survive are the ones who are going to figure out how to do things virtually and not so much worry about the brick and mortar. So, what we already saw happening because of Amazon and Walmart is just going to become more and more dramatic in my mind. And that is going to change all of shipping for sure. This thing that they're going through in December, I mean, last December, they had a rough December last December, but it's nothing like what they're going through this year. And I think this is the new normal. You're going to see a lot more ads on television, UPS, FedEx, hiring, come work for us. The great joys of working in logistics and transportation. That's here to stay, I think.
Excellent.
I'm going to offer a thought as well as I think about it more. So I have maybe a unique experience of, I used to work at a place called Google X, and I was close to the self-driving car development there and did some things there. Right now we're experiencing acute shortage of drivers in the transportation industry, the ship and get and stuff that Gary's talking about. They come and a lot of brokerage firms come and hire drivers away from our DCs. Transportation firms we've contracted with get drivers hired away. It's this need to move freight around the country is real. It's dynamic. It's growing. It's massive. But the technology is there. Companies are developing it. You're going to have self-driving semi-tractors happening very, very soon. That's going to radically change transportation. It's going to be a game changer, and that is coming. I've seen the technology. It works for cars. It'll work for trucks. That will come at a very needful time.
I think it's going to be sooner than everybody thinks.
Totally agreed. It is coming.
So we have a couple of questions here which kind of go hand in hand. So I'm going to sort of kind of try to focus it. So the one question is, how does one switch from marketing to supply chain? Well, they seem so different areas that require different skill sets. So I will respond to that one. That is, you know what? You've got to do what is exciting to you. And I'm assuming that's coming from a student. Come talk to me. Go talk to your academic advisor. We'll get you switched over. We'll take all the supply chain talent we can get. But the bigger part of that question here is that which relates to that is, what skills are critical for landing a job in supply chain?
I'd go with 2 if I can jump in. I think analytical skills. So those folks that are good at math, thumbs up to you. I was not, and I've learned it, and it's a great skill. And then, frankly, they talked about learning, but the ability to lean in with your stakeholders, because you're going to do lots of things over the course of your career. I remember working in the semiconductor industry. They were sourcing equipment that was as sophisticated as satellites, not even joking. And I had to learn about that, and I had to learn that from content experts. Your willingness to say, I don't know anything. I'm going to lean in and learn about this technology or this product or whatever it is with your stakeholders so you can do the job well. That's carried with me wherever I've gone in my career.
I'll add to that. I agree totally with everything James said. I think accounting is a big deal. I think understanding the profits and the way the income statement reads, I think the more you understand that, the more impactful you can be. And the other thing I would say is being more strategic minded, less tactical, less focused on what to do, and more on what should we do, where is the future, where do we go, how does this fit. I would definitely work on your strategic abilities.
Might have taken that in a slightly different direction. I don't disagree with what's been said, but from my perspective, especially when I'm hiring right out of school, I am less concerned about the technical skill set. I will teach you those things. I am more concerned about the soft skills. How are you with customers? Are you able to bounce between, to Gary's point, the tactical thing I've asked you to do and deliver it, but can you also think strategically and step back and understand a bigger picture? Are you willing to lean in and learn something new? And I guess the one piece of advice I often give when I talk to college students is say yes to the opportunity. It's okay to be uncomfortable. In fact, it's great to be uncomfortable. Learn something new. It won't be as uncomfortable the second time, but don't say no just because you don't think you can 100% do it perfectly. The answer should be yes, and you should be seeking out opportunities to really diversify your skill set and your background. You'd be shocked how many volunteer opportunities 10 years later, I gleaned something from something that I thought was just, charitable work for a day, and have been able to use a skill that I picked up or a relationship that I made while I was doing that. So soft skills and saying yes to opportunities as they're presented to you, I think is very important.
It's a great answer. That's a great answer.
I agree. One of the things I would like to say is, the more you say yes, you earn the right to say no. And so long as you're willing to be flexible, particularly in that early career, it's going to create opportunities. So I want to thank our panelists for taking time away from their busy schedules today to be with us. Just outstanding insights. I think I've certainly learned a lot from our 4 panelists here. I appreciate the audience who has given us a lot of good questions to think about. And I think with that, I think we'll bring the session to a close. Again, thank you again to James, Kim, Allison, Gary. Always a pleasure having you here. Anytime you want to come spend time with our students, we will find a way to make it happen. So thanks again. Thanks to everybody, and have a wonderful Friday.